AM 1240 WGBB.com, and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in tonight. We have a great show tonight, something a little different. We have Dr. Stephen Grossman, the premier cosmetic dentist on the South Shore in Babylon. Dr. Grossman, welcome to the show.
Thank you so much. I'm happy to be here.
Thanks for taking some time out of your schedule to talk with us. So the topic of tonight's show really is going to be who's a candidate for cosmetic dentistry. And I think of all the things that our listeners ask us about, cosmetic dentistry is probably one of the most popular. And, you're really known as the go-to guy on the South Shore for that type of thing. So I wanted to talk to you about that and pick your brain a little bit. Sure. And educate our patients. So,
my pleasure.
Before we get into it, just tell our listeners where you went to dental school, where you went to college, that sort of thing.
Okay. I grew up in the Bronx. I left for college in 1968. I went to dental school also at Stony Brook. I was in the first graduating class of the School of Dental Medicine there. And I've been in practice about 30 years now.
Wow, that's terrific. And so after dental school, did you just go right into practice?
No, I did a one-year residency at Albert Einstein Medical Center in the Bronx.
Uh-huh. Tell our listeners a little bit what's the value in seeing a dentist who's done a residency such as that.
You get much more proficient at just about every phase of dentistry, from diagnosis to every kind of treatment. When you get out of dental school, you're used to having 2 hours to do a filling or 4 hours for a periodontal surgery. You do a residency in a neighborhood like the South Bronx, you've got to be, it's a MASH unit, pretty much. And you get a lot of experience. It was invaluable.
Mm-hmm. You probably do a lot of things there that you never do again, but because you've done so many things there, the stuff you normally do becomes second nature, becomes like nothing.
It's true. And you didn't get phased. If you had eight patients to get through in the next hour and a half, you got through them.
Yeah, it's really something.
Yeah.
So where's your practice now?
My practice is on Deer Park Avenue in the village of Babylon.
And how long have you been there?
I've been there since August of 1998.
Okay. And before that, you were where?
I was in Deer Park for a number of years.
So you've been in the community a long, long time.
A long time.
I know you were telling me before the show that you have patients now who were children of your old patients.
It's true. I'm treating patients now who are the age their parents were when they started with me.
That's a nice thing.
It's very nice. I love it.
I think that's a real credit to you, that a family would look to you like that you would stay their dentist.
It's a very friendly office. It's a very warm environment. There's a lot of kibitzing, joking around. I sing a lot all day long. We try to keep it as stressless as possible because it's a stressful thing to go to the dentist. So many people are fearful. So if you can defuse that fear when they get in just by the atmosphere, you're ahead of the game.
They feel much better.
Oh,
they
absolutely.
feel much better. How old were you when you decided you wanted to be a dentist?
I actually had graduated college when I decided to be a dentist. I took a year off after college. I didn't know what I wanted to do. I worked a number of jobs. My mother's third cousin, who was the family dentist, said, "You come and hang out in the office for a week. You're not doing anything." So I went in. I got paid less than minimum wage, but he was that type of dentist. He was very warm, cracked a lot of jokes, very friendly with the assistants and the hygienist in the practice, and it just looked, this is a great place to spend a day. Mm-hmm. I think I might do this.
And the rest is history.
And the rest is history.
As they say. So let's get into tonight's topic. We want to talk a little bit about cosmetic dentistry. And let's just talk a little bit about first, who's maybe the typical patient that comes into your office that wants cosmetic dentistry or a smile enhancement?
I would say the average, it's usually female. Mm-hmm. And then they bring their husbands later. But it usually starts off as female, someone between the ages of 25 and 40. Mm-hmm. That's the most typical patient. But people of all ages are pursuing cosmetic options now because they watch television, they read magazines, they see the newspapers. I mean, Obama's got a great smile. Mm-hmm. Wherever you look, people have had whitening, they've had veneers, they've had orthodontic treatment. So it's the new normal, let's say.
Have you ever had a Republican come in and say, "I want to smile like Obama's"? Has that happened or no?
Not yet.
Not yet. They're thinking it, but they're embarrassed to say it.
Remains to be seen.
So let's maybe go through the ages. What are who's maybe what's the lowest age? I mean, maybe we have some people listening now who have kids who are 12, 15, teenagers. What's sort of the youngest age where you would think about enhancing someone's smile? And what are some of the procedures that they would do?
Well, I don't advocate cosmetic procedures unless they're necessary, really necessary for appearance. If a 14-year-old comes in and they want to have their teeth bleached and you're too young for this. Keep them clean. We'll teach you proper hygiene. We'll get them as wide as we can in the office. We'll recommend something over the counter that's appropriate for their age group. I think on a developing dentition or on a young dentition that hasn't been exposed to much yet, not enough eating, not enough grinding, not enough chewing, who knows how these adult procedures will work on them in the long haul.
So really, it's maybe when they get into the early 20s that things are set that you would think about...
Yeah, I would think about whitening someone's teeth because it's important to them. Let's say when they're in high school, 17, 18, for the prom or for a sweet 16 possibly, but not the same treatment we would give an adult. But we would consider it at that point. Also, veneers for teeth that are discolored by, let's say, tetracycline staining, medication they took as toddlers that affected their developing permanent teeth. And it is unsightly. And they are the object of derision from some of their peers. So, yeah.
Well, let's talk about that a little bit. You know, I think to some of our listeners, they feel that having cosmetic dentistry or a smile enhancement is almost frivolous to do. But like you say, you know, people can be brutal to other people, especially when they're young. What are some of the emotions that people come in with before cosmetic dentistry? What sort of things do they tell you about how they feel about their smile?
They've told me that they smile always with their hand over their mouth. They've been aware of that look that they hate since they're, 12, 13, since they first were developing their adult self-esteem. There is a lack of self-esteem in people who don't like their smile. And they actually feel people are noticing it more than people actually are. And it affects their job performance. It affects how they interview with other people. It affects their confidence when they're going on a date. I think it's about as frivolous as losing weight. I think it's a way to look your best. Why shouldn't we look our best if we have the tools to do it?
Yeah, I agree. And so after you enhance someone's smile, what are some of the things that they say to you in terms of how they feel?
Oh, they just can't believe how they're smiling all the time for absolutely no reason.
Yeah.
They look for opportunities to smile. Their self-esteem is through the roof. They're more confident at work. People react to them differently than they did before because they're more confident. It's as much a reflection of the change in their looks as the boost in their self-image.
What sort of stories have patients told you over the years? Have you had people that got their smile fixed and got married or finally got that promotion or those sort of things?
I have people that closed big deals or got good jobs. They went for an interview with this new veneer or this snap-on smile that they're wearing. I had a woman who was doing real estate for years, and she was a very attractive woman, but her teeth, not so much neglected as the care was not great, and she had lost a number of teeth along the way, and some of the fillings were unsightly, but she couldn't afford to do what she wanted to do. She'd gone for consultation. They were quoting her $30,000, $40,000 to do her whole mouth and get the look she wanted. So she had heard about Snap-on Smile. She went on the website, and she saw my name. She called the office. She came in. She looked totally different the day that she came in for the impressions and the before pictures. When she came to pick them up, she had her hair done. She was all made up. She had a different outfit on. All the accessories were like from a magazine. And she said when we photographed her after, she said, "You must photograph my whole face. I don't want to show just my smile. I want you to put my whole face up."
That's great.
Yeah, that was terrific.
And she sold the house that day.
She did.
Yeah,
it was incredible.
Well, you know, it's interesting what you see is that other people really sense someone's confidence, and it's such a subtle thing. It's such a subtle form of communication, but it just radiates, or the lack of it radiates as well.
We are how we project ourselves, and if we're insecure about our appearance, you can't project yourself well. If you're worried about the bulge over your belt, or you're worried about that black tooth in the front, you're not going to have a good day.
Yeah, it's true. So, you know, you mentioned Snap-on Smile, and we've never discussed that on the show before, so you're going to make Healthy Living Radio history.
Cool.
Tell our listeners really what Snap-on Smile is.
Snap-on Smile is a very intricately produced, very durable acrylic. It is a template that slips over the existing teeth in your mouth. It replaces missing teeth, and it cosmetically enhances every tooth that it covers. So basically, it snaps over your teeth. You can sleep with it, you can eat with it, you can drink with it. You take it out to brush your teeth, and you rinse out the inside of the Snap-on Smile. There's an antibacterial gel that you put in the Snap-on Smile, so while it's over your teeth, it's keeping the gums and the teeth healthy. It's a great tool. I had a pair made up for myself because I wanted to see what it was all about after I took the course. So I wore them, and I do community theater, so I went to a rehearsal that night of a show I was directing, and people in the cast that I'd worked with before came over to me and said, "You know, I never noticed before, but you've got gorgeous teeth. So I snapped one of them out, and I said, you can buy one.
So tell our listeners what's involved in getting a snap-on smile. If someone doesn't like the way their teeth look and they say, I want to look into that, what are the visits like?
The visits are, you come in for a complete workup of your mouth. We take a full mouth series of x-rays. We do a visual examination. We check for oral cancer, because I do that on every patient that I have. We actually have a new machine called a VELA Scope that screens for oral cancer. It's based on shining a light in the patient's mouth. The tissue in the mouth absorbs it and fluoresces it back, reflects it back. And based on the color family, we know if we're looking at precancerous, so cancerous cells that you could not see with just the eye. But anyway, that's part of the first visit.
We're going to get into that later in the show. I do want to
later.
ask you more about that. But let's get back to the snap-on smile.
We just basically take impressions and a bite before pictures.
So there's no Novocaine, no drilling, none of the things that make people anxious?
You don't want to put a snap-on smile over an area that has decay or that might become infected. So yes, if they're going to have some dental work that involves fillings, possibly a root canal if they want to keep the tooth, they have to have that done. You can't put new siding on a lousy foundation. The foundation has to be healthy, but the siding just snaps right up.
Amazing.
It is amazing.
And what do people typically say when you put that in?
Oh, my God. Oh, wait till my mother sees me. Stuff like that. Yeah.
Now, I know we were talking before the show, and one thing that I really enjoyed from our conversation was I think a lot of patients have the perception that when they want to enhance their smile, that it's very, very costly, that there's only one way to do it. And you were sort of telling me that there's a nice a spectrum of options, available from really very, cost efficient to maybe more costly. And maybe you could just take us from beginning to end in terms of what people's options are.
People come in, they have to have an idea of what they want to look like at the end, or they have to have some kind of an idea of what about their smile troubles them. And we'll kind of hone in on that and figure out what the problem is. Some people think they need a whole mouthful of veneers. They just need some whitening, maybe some minor orthodontic tooth repositioning so the teeth look larger and they're more prominently placed. Nothing is recessed, nothing is catching darkness. So sometimes minor orthodontic tooth movement and some bleaching achieves the effect that whitening would achieve. That a full mouth of veneers would achieve.
So somebody listening at home that thinks their teeth are terrible and is maybe staying away because they think, boy, this is going to be $30,000, that's not necessarily the case.
Snap-on smile is a much cheaper option than that. It's basically affordable. If you like to go to Vegas for a weekend, you can have snap-on smiles.
Really?
Yes.
Really? And how durable are they? What can someone expect in terms of how long it should last?
You should be able to have them in top condition for 3 to 5 years.
Really?
That's basically it. And you can get a manufacturer's warranty through the office for $99, and they're covered in full against breakage for 3 years.
Really?
Yeah.
So do you find that some people sort of start with a snap-on smile, never imagined how good their smile can look, and then move to more non-removable replacements?
Yes, it buys you time. It replaces things that are missing, but it doesn't preclude having implants done at a later date. That's the beauty of it. It snaps in, it snaps out. When you snap it out, there's nothing under there that was changed. Everything was made healthy, and this snaps over it. You can have implants done, you can have regular traditional bridge work done, you can do whatever you like, because this thing comes out.
Who's your typical patient that has a snap-on smile?
I would say people that either through fear or financially were unable to seek more comprehensive treatment all along the way. So they reach the point where they may be 40, 50, 60. They have their daughter's wedding coming up. They have a high school reunion to go to, and they don't want to go because they look horrible in their own mind. They come in, we assess the situation, they get the snap-on smiles. It takes 20 years off them. You can also increase the height of vertical dimension with snap-on smile. You can eliminate some lower wrinkles as well, because we tend to lose some height of face as we get older. You can restore it with this in one fell swoop.
How do people hear about, aside from our listeners who are very well-educated people, obviously,
yes.
But how does the average person hear about snap-on smile? Because I would guess when you mention it to them, they've never heard of it before.
Well, there's a website, I think denmat.com, who's the manufacturer, or snaponsmile.com. You can find it online. They were supposed to be doing a more comprehensive advertising campaign for it, as far as we knew, but I don't see it on TV either.
But do you find that snap-on smile patients are people that maybe you did one for their friend and they just loved it, or is it
yes.
more than your conversation with the patient? You say, "Hey, we have this option, snap-on smile," or both?
People have come in that haven't heard of it. People come in because their sister had it done. I would say it's 50-50.
I would guess they're really very excited to know that there's something like that available that's
Yes.
non-invasive, completely reversible, and super affordable.
I just had a guy in last week. Both he and his sister have very noticeable diastemas, spaces between their two central incisors, their two upper front teeth. And they've hated it since childhood, the two of them.
Mm-hmm.
And the sister also had periodontally involved teeth that had to go. So she went first, and she had her care done, and she had the snap-on smile. The brother came in like a week later, says, I'm ready. Where do I sign? I got to do it. I got to do it. Yeah.
That's great.
So, yeah, it's a
That's
great result.
Now, you mentioned, sort of along the spectrum of things that are available. The next thing you mentioned are veneers or laminates. And
Yes.
maybe just tell our listeners a little bit, exactly what that is and what you can accomplish with that.
A laminate is a porcelain front that slips over the chewing edge of the front tooth and covers the entire side of the tooth that faces the public, so to speak.
Mm-hmm.
It's like siding on a house, but it gets bonded in place. We work exclusively with Veneers, also produced by Denmat. There's no preparation of the teeth, which means that when you come in, you don't have to have your teeth ground or anything. Nobody drills on your teeth. We just fix whatever decay is in the area, and then we have the Veneers made up. They get bonded right over the tooth with no alteration of the tooth surface.
So if someone has healthy teeth to start with, do they need to be numbed to have that done?
No, not at all.
So they come in healthy teeth, take an impression, take a shade, and how long does it take to make those?
Usually about 3 to 4 weeks.
Really?
Yeah.
And then they come back, and what's the visit like when they're put in?
We isolate the arch, we isolate the teeth, keep them dry. You have to etch the surface of the enamel to make it slightly porous. The veneers get put on with a bonding agent. We shine a light on it. They get trimmed up. They go home.
And it's done. And then what do people say when you hand them the mirror?
Oh, they go crazy.
Yeah.
They go crazy. Yeah. Sometimes we'll do a wax up in advance so that they'll see what the teeth are going to look like. But there's nothing like seeing it on your face, in the mirror when you finally get them bonded in.
What's the process like? Let's say that a new patient comes to your office and she says, you did my friend Sally's teeth. She looks fantastic. I've always hated my teeth. Take me through what a patient will experience in your office when they come in to have their smile enhanced.
Okay, we'll come in. We'll talk a little bit about general background, where they grew up, family structure, how many children, what they do in the real world. Try to get to know them a little bit. Then we start to talk about what about their smile they're not happy with. What are they hoping to achieve? Bring in a magazine from the waiting room. Let's leaf through it together. Let's look. Let's see whose smile you admire, whose smile you would love to have if it didn't cost you anything and you woke up tomorrow morning with it. And then we discuss the options in the way of achieving it. It's either going to be minor tooth movement, it's going to be whitening, it's going to be veneering, or it's going to be a whole snap-on smile makeover.
Should a patient, if there are people that just know they just don't like their smile but can't articulate why, is that a problem? Can you still help them, or do they need to be able to say what they don't like about their smile?
Most people can pinpoint what they don't like about their smile, but I'll sit with them in front of a mirror and we'll point to each individual tooth and say, what do you like about this one? What don't you like about this one? And they'll tell me, this one looks a little twisted this way. It always looks dark when I smile. So we break it down that way.
I know, before the show when we were talking, and I was really impressed that you sort of said to me that, I'm going to paraphrase what you said, that it's sort of important to you that you can deliver the goods for the patient. In other words, that they had a realistic expectation that what they had in my mind that you knew you'd be able to deliver. And I would assume that comes with, obviously tremendous experience and reading the patient after a while. But how do you know that? How do you know from talking to the patient that what they have in their mind, that when they're done, they'll be happy?
We try and be as descriptive about the process as possible. We show them before and after pictures of previous patients. And we said, do you like this result? Are the teeth large enough? Are they too large? Are they too white? Are they too straight? Do you want it more natural looking? Because natural, we know, is not big, white, and straight. But that's not what's in style now.
Right.
Yes. Unnatural is what's in style now. Because we're all resisting aging. All the boomers and the younger boomers and whoever's coming down the pike next.
Yeah. Well, let's talk about that. So what are some of the, I know we spoke that there are people in their 20s that come in, and then there's, maybe people entering the job market or a middle manager, needing to move up. Do you see a lot of people that, the first wedding is coming up or those sort of things and they want to get their teeth fixed?
Oh, absolutely. It's very necessary for a lot of people to feel confident in their careers and in their peer group and with family.
And at what age do people stop caring about what their teeth look like?
I don't think people really ever stop. I don't. Unless their general health is so poor that what the hell? My feet hurt, my teeth are gone.
Is it unusual for you to have, healthy, vital 70, 80-year-olds who come in and say, you know what, I never liked the way these teeth look, I want to fix them?
Yes. Unfortunately, we've seen this after a spouse will pass away and a suitable amount of time goes by and they want to re-enter the world, the world of the living. And they want a makeover. And it includes more than a new hairdo.
Do you find that people sort of almost become somewhat recluse? I mean, at some point in their life, if they're so embarrassed about their teeth that they don't socialize as much, they don't enjoy life as much as they
I think
could?
They definitely don't enjoy life as much, because a life without social activity is not really a life. It's an existence.
Yeah, it's such a big thing. And I think a lot of people don't realize how important a smile is.
I think the scary thing about the world now is just people are getting so used to being in their own little cocoon. I mean, you can order food from the house. You can watch any movie from the house. You don't have to leave the house. People are getting to be tremendous. And a fair segment of the population is, quote unquote, letting itself go. And I think we have to reverse that trend.
Yeah. I'm sure there are some people listening who haven't been to the dentist in a long time, and they're looking in the mirror at their teeth, and they don't like the way their teeth look. What are some of the... Do people feel embarrassed when they haven't been to the dentist for a long time and then they finally come in after a long time?
People come in and apologize to me that they didn't take care of themselves.
And you've never met them.
Who am I? You don't have to apologize to me. I've seen much worse than you've got. Believe me.
So that's a common emotion that people have, that theirs is the worst.
Yes.
It can never be fixed.
You go to Weight Watchers, I must be the fattest person you've ever seen. Oh, no, did you see the 3 who just left? It's the same thing. You know what we see in practice.
What kind of things did people say to you why they've stayed away from the dentist all those years?
Well, misconceptions about the cost. They've had no insurance coverage, which is a big deal. Fear, lots of fear. People are frightened from stories they've heard, from experiences they've had, from cable movies they've seen, from newspaper articles. There was a woman recently, it turns out it was a hoax, but she supposedly sedated her fiancé after he jilted her.
That was a hoax?
I think it was a hoax.
Oh, yeah?
I didn't snope it. So, yeah, but these things are unsettling. I didn't have such great experiences as a child, and this is one of the reasons I think I became a dentist. So.
Yeah, I didn't either. It's funny. It's same sort of reason. In your mind, you think there's got to be a better way. There's got to be a better way to do it.
Yeah,
that's interesting. So, it sounds to me like you really enjoy these cosmetic cases. I mean, you're a general dentist, so you do a wide range of services: cleanings, fillings, crowns, root canals. I mean, of all the things you do, is there anything more exciting or satisfying than cosmetic dentistry?
Getting people out of pain is very good.
That's a good thing, too.
But this is even better, because you're a hero. You've remade their face. You've remade their life. And when you see them at recall, and then they become regulars, then they start coming regularly because they want to maintain this fabulous change they've effected. And it's very gratifying. It's an instant fix. It's like you paint a room. Oh, wow.
That's a great analogy. I've never heard that before. That's a great analogy. You walk in and it looks brand new.
That's right.
It looks brand new. Do you get a lot of people, I mean, you've been in practice a long time, and is it common to have people that have been in your practice 5, 10, 15, 20 years, and then one day they come in for their maintenance visit and they say, you know what, Dr. Grossman?
Yes.
I think I want to fix my teeth today.
I know. Yeah, it happens, and I'm always flabbergasted.
What sparks that for people?
I don't know. Sometimes it is they have a college reunion coming up or a high school reunion. But I don't know. People wake up one day or they've seen a picture of themselves that they absolutely detest and they didn't know they looked like that.
And they just want to take care of it.
Or their wife finally got through to them.
And then so when you finally do the treatment for those people, what do they typically say to you?
They're amazed at the change. They're so happy. And then when they leave, they come back even happier later because they see the result it has on other people.
That's interesting. Yeah. And do people typically say to them, hey, I love your new teeth, or do they say something's different about you? I don't know what it is, but you look great.
If the people did realistic treatment, which is they didn't make their teeth as white as paper, people don't always notice exactly what it is. They'll say something, you look great. Did something happen? What's new? You know, that kind of thing.
Do you ever hear patients say to you, I wish I had done this a long time ago?
Absolutely. Absolutely.
Yeah. Why do you think they delay?
Fear. Money.
Yeah. Yeah.
And they're raising their children. They're educating their children. They have a new house. It's, you know, there are stages in life. And I think the boomers, as they're hitting 50 and 60 and beyond, and maybe their kids are lucky enough to be self-sufficient now, they've got some spare change for themselves. Or they decide, now it's my turn.
What about, say, people even that are, don't have any teeth anymore? Maybe they're wearing an old, dingy denture. Maybe tell our listeners about really, how often someone should change a denture and how someone can look better with a new denture.
People can look tremendously better with a new denture, especially after 5 or 10 years, because most of the teeth are acrylic. They wear down, they discolor, and they look dingy, and their lower half of their face collapses, so they look older. They've got deeper lines at the corners of their mouth, and they don't realize how poorly these things fit.
It happens so gradually.
Gooping them up with Fixodent, and it's just, I'm using half a tube this week. Last week I was only using a quarter, but I'm still comfortable,
Yeah.
My wife thinks I look like hell, but I'm happy.
I think it's so gradual. It's like the old sneakers. Your old sneakers feel great, and until you put on the new pair, and then they feel even better.
Until your wife throws out the old ones.
Exactly. You come home from work one day, hey, where are my sneakers?
With the sweatshirt.
That's pretty funny. What are some of the most common questions? I'm sure when you go to a cocktail party or, you're hanging out with people that you meet and they hear you're a dentist, what are some of the most common questions you think people have about cosmetic dentistry?
Basically, is it going to hurt? Will I need a shot?
Really? That's the number one?
Most common question. I think that's the most common thing that keeps people away. If everyone listening could show up at my office tomorrow morning knowing that whatever I have to do to them, they will not need an injection, they will feel no pain, they'll be there.
Interesting.
They'll be there. They'll be putting off that thing that's been bothering them since the week before Memorial Day.
Yeah, and take care of it.
That at the party they went to on Memorial Day, they couldn't drink any lemonade because the ice cubes were just too cold.
Too sensitive.
Yeah.
Too sensitive. Before we wrap up, I want to talk a little bit about the VELA Scope and maybe tell our listeners really how big a problem oral cancer is. And, let's start with that. How big a problem is oral cancer?
Oral cancer is on the rise, as so many cancers are not. I think it's one of 3 or 4 cancers that are on the rise, whereas most others are declining. And it's, of course, oral cancer is spread very often now among young adults through the human papillomavirus, the HPV.
I had read recently that there are more deaths every year from oral cancer than from melanoma.
Yes.
From skin cancer.
Yes, that's scary.
Which is amazing.
Because people are using sunscreen, they're not using protection.
Right. So what sort of things can a patient do? First, what's the key to surviving oral cancer? And
early detection.
And so tell us what the advantages of VELA Scope is compared to, say, just looking at the teeth.
We always have done a very thorough clinical examination of the oral cavity looking for suspicious areas, things that might be lesions. The beauty of VELA Scope is that with this tissue fluorescence, there's no doubting when you see a lesion. There's no doubt. It fluoresces differently than any other healthy tissue in the mouth.
Tell our listeners what that means, fluoresces. So take us through the VELA Scope process. I'm sitting in your chair. You tell me about VELA Scope. I say, let's go. That sounds great.
Right.
What happens?
We just put some protective lenses on you because the light is quite bright, so we don't want you to see it. We don't want to shine in your light by accident. And we examine the mouth with the VELA Scope. The tissue glows when we shine the light in your mouth. The areas that don't glow, that show up blackened with an irregular border, those are precancerous or actual cancer at the site. And if you detect it before you can see it with the eye alone, the prognosis is much better.
Interesting.
Because all cancer is a deadly cancer.
And how often should somebody have that VELA Scope done?
We recommend it as often as you have a series of x-rays every year and a half. And this is it's recommended now by the ADA for all sexually active beings over the age of, get this, 12.
Really?
Yes.
Interesting. It's funny. Something like a Pap smear has become so commonplace.
Yes.
Nobody questions when they go to the doctor and they have a Pap smear,
right.
Unless they're male, of course. Then there would probably be some conversation.
That's a little frightening.
Right. But as far as, but it sounds like that really should become the standard. Should become the norm.
I absolutely think so, and I think they should be introducing it in colonoscopies and endoscopies.
Yeah, and for the patients. Does it hurt? Is there any discomfort involved with it?
None at all. It takes about 3 to 4 minutes. We take a picture for the record, and that's it.
And that's it. And in the time you've done the VELA Scope, have you discovered anything that before you wouldn't have seen?
Yes.
Really?
Yes.
And then, so what's the follow-up?
Luckily, it turned out to be benign.
Right.
I refer to an oral surgeon who biopsies it.
And what's interesting is you're a dentist with 30 years experience. You've been doing it visually with 30 years. So the benefit of the VELA Scope isn't a shortcoming on your part. It's a limitation of what the eye can see.
Absolutely.
Without that aid.
Absolutely.
That's a tremendous service. Are patients accepting of that?
A lot are, yes.
Yeah.
And I'm glad to see it. I wish more insurance carriers would cover it.
Yeah.
Because I think it's one of the most valuable things you can do at a dentist is to find out whether you have a precancerous situation in your mouth.
Yeah. And nobody ever thinks it will be them. So, it's always easy, that's not going to be me.
I know.
But I think most people, like you said, don't realize that oral cancer is really on the rise in people who don't smoke and don't drink, which traditionally were the two biggest risk factors.
Very good point, yes. And it's younger adults.
Yeah.
It's not the old sailor who was always drunk and smoking.
Right. It's really very interesting.
Yeah, it's young adults. Women predominantly are at risk, but now young men are contracting oral cancer, and that can be caught just by kissing an infected mouth.
Yeah, it's amazing. It's very
scary as hell.
It's very frightening. It's
Yeah.
very frightening. I hate to end on a bummer like that, but we're almost out of time. Maybe you could just tell our listeners where your practice is, how if you have a website, a phone number, how people can get in touch with you.
I don't have a website, not as yet. The address is 454 Deer Park Avenue, and that's in the village of Babylon, New York. And my phone is 661-6666.
That's great. So to sum up, if you don't like your smile, check out Snap-on Smile. I think that's a great service that you can offer people. I think the VELA Scope is tremendous, and I compliment you for offering that in your practice. And I want to thank you for being on the show. I learned a lot tonight. It was a great show.
My pleasure. Anytime.
So, you've been listening to Healthy Living Radio. I'm your host, Dr. David Scharf. Thanks for tuning in, and we'll be with you next week. Have a good night.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.